When asked, "How do you check your blood sugar?" many will say they check their blood sugar in the morning when they first get up and before they eat anything. They'll give you a number but have been fasting for 8 to 12 hours or longer, depending on their last meal, leaving them unaware of how food impacts their sugar levels. Many check their blood sugar immediately after eating and, upon seeing high numbers, decide not to check again until the next day. Those using insulin often attempt to correct high numbers quickly by injecting more insulin, or they eat less next time to avoid such numbers. They are constantly chasing numbers. However, there are effective strategies for monitoring blood sugar that involve testing before meals, after meals, and eating identical meals for a period of time to gain valuable insights into how your body metabolizes and responds to specific foods. This method aids both you and your healthcare provider in better understanding and managing your diabetes. We now have continued glucose monitoring, CGMs for short, which are devices usually used by type 1 diabetics who rely solely on insulin to monitor their blood sugar 24/7. However, more and more type 2 diabetics on both oral medications and insulin are using CGMs as their blood sugar levels unpredictably fluctuate from one extremely low to extremely high. Understanding how to balance your insulin with your food intake is crucial, akin to walking a tightrope. Through our program, one can understand how blood sugar works, how to monitor it correctly, and maintain stable blood sugar levels without experiencing the highs and lows.